Hello everyone, and welcome back to the Wellness Zone. Did you know that prostate cancer is the second most common cancer among men worldwide? Today we're uncovering the hidden signs of prostate cancer, a silent threat that could be lurking undetected. Stay tuned as we explore the early signs, prevention strategies, and the latest research that could save lives. Section 1. Understanding prostate cancer. Prostate cancer is a condition that arises when cells in the prostate gland begin to grow uncontrollably. The prostate, a small gland found only in men, is responsible for producing seminal fluid that nourishes and transports sperm. This type of cancer is one of the most common among men, and its occurrence increases with age. Interestingly, not all prostate cancers are the same. Some grow slowly and may never cause any problems, while others can be aggressive and spread quickly. This is why understanding the nature of prostate cancer is crucial. It's a disease that can be a silent invader, often showing no symptoms until it's advanced. But with modern medicine, if caught early, the prognosis can be very good. Did you know that the first successful use of chemotherapy for prostate cancer was in the 1950s? Since then, treatments have evolved tremendously, offering hope to many. Section 2. Risk factors for prostate cancer. Knowing the risk factors for prostate cancer can help in its early detection and prevention. Age is the most significant risk factor, with the majority of cases occurring in men over 50. Ethnicity also plays a role. For reasons not fully understood, African American men have a higher incidence of prostate cancer than men of other races. Family history is another important factor. If your father or brother has had prostate cancer, your risk is more than doubled. Genetic mutations, such as those in the BRCA1 or BRCA2 genes, also increase the risk. Lifestyle factors like diet and exercise can influence risk as well, with obesity being a known risk factor. Here's a fascinating fact. Did you know that the tallest men in the world are at a slightly higher risk for prostate cancer? Studies suggest that height can be an indicator, though the reasons remain unclear. Section 3. Early signs and symptoms of prostate cancer. When it comes to prostate cancer, the early signs can be subtle and easily overlooked. That's why it's vital to listen to your body and recognize the changes that may indicate a problem. Let's break down these signs one by one. Number 1. Trouble urinating. This is often one of the first signs men notice. It can manifest as difficulty starting the urine stream, a weak flow that stops and starts, or a feeling that you can't completely empty your bladder. Number 2. Frequent urination. If you find yourself getting up several times at night to use the bathroom, it could be a sign that your prostate is enlarged, potentially due to cancer. Number 3. Decreased force in the stream of urine. A weakened urine stream may indicate that the prostate is swollen and pressing against the urethra, affecting the flow of urine. Number 4. Blood in urine or semen. This can be alarming, and while it's not always indicative of cancer, it's a symptom that should never be ignored. Number 5. Pain or discomfort in the pelvic area. Persistent pain in the lower back, hips, or thighs can be a sign of advanced prostate cancer that has spread to the bones. Number 6. Bone pain. This sign is particularly concerning as it may suggest that the cancer has metastasized to the bones, which is more common in later stages of the disease. Remember, these symptoms can also be caused by conditions other than prostate cancer, such as benign prostatic hyperplasia, BPH. However, if you're experiencing any of these symptoms, it's crucial to consult with a healthcare provider for an accurate diagnosis. Did you know that prostate cancer cells can actually create their own testosterone to fuel their growth? That's why treatments often focus on hormone therapy to cut off the supply of testosterone to the tumor. Section 4. Diagnosis and screening. Detecting prostate cancer early can be a game changer, and that's where screening comes into play. The two primary methods are the digital rectal exam, DRE, and the prostate-specific antigen, PSA test. It's important for you to understand them to get the correct diagnosis. Number 1. Digital rectal exam, DRE. During a DRE, a doctor inserts a gloved, lubricated finger into the rectum to feel the prostate gland. It's a quick way to check for any abnormalities. Number 2. Prostate-specific antigen, PSA test. This blood test measures the level of PSA in the blood. Elevated levels can indicate prostate cancer or other prostate issues. If these tests indicate a potential problem, further investigation is done through an ultrasound or a biopsy. An MRI may also be used to create a detailed image of the prostate. Did you know that the first use of PSA testing began in the 1980s? Since then, it has become a cornerstone of prostate cancer detection. Section 5. Treatment options. Once diagnosed, the treatment landscape for prostate cancer is varied, depending on the stage and grade of the cancer. Let's look at them one by one. Number 1. Active surveillance. For low-risk cancers, doctors may recommend monitoring the cancer closely and taking action if it grows. Number 2. Surgery. The removal of the prostate gland, known as a prostatectomy, is a common treatment for localized cancer. Number 3. Radiation therapy. This uses high-energy rays to target and kill cancer cells. Number 4. Hormone therapy. Also called androgen deprivation therapy, this treatment reduces the levels of male hormones that can fuel prostate cancer growth. 5. Chemotherapy. Used for advanced cancer, chemotherapy kills rapidly growing cells, including cancer cells. Number 6. Immunotherapy. This newer form of treatment helps the immune system fight cancer. Each treatment has its own set of benefits and risks, which doctors will weigh against the patient's health and preferences. Section 6. Prevention and lifestyle. While there's no surefire way to prevent prostate cancer, certain lifestyle choices can reduce risk. Number 1. Diet. A diet low in fat and rich in fruits and vegetables may help reduce the risk of prostate cancer. Number 2. Exercise. Regular physical activity can improve overall health and may lower the risk of prostate cancer. Number 3. Maintaining a healthy weight. Obesity may increase the risk of prostate cancer. Number 4. Smoking cessation. Quitting smoking can improve your overall health and potentially reduce the risk of prostate cancer. It's interesting to note that studies have shown a correlation between dairy intake and an increased risk of prostate cancer, though more research is needed to understand this link fully. Section 7. Patient stories. Hearing from those who've walked the path of prostate cancer can be both enlightening and inspiring. Let's hear a couple of stories from real-life warriors who face prostate cancer head-on. Ron's journey. Ron Lewin's story is one of vigilance and the power of research. Diagnosed with early-stage prostate cancer, Ron didn't take his diagnosis lying down. Instead, he turned to the internet, researching his treatment options extensively. His choice? Proton therapy, a cutting-edge treatment that targets cancer cells with precision, sparing healthy tissue. Ron's story is a testament to the importance of understanding your options and finding a treatment that suits you. He also emphasizes the importance of support systems, whether it's family, friends, or support groups, and how they played a crucial role in his recovery. These stories not only provide hope, but also highlight the diverse experiences of men dealing with prostate cancer. They remind us that every journey is unique, and there's no one-size-fits-all approach to battling this disease. Section 8. Advancements in research. The landscape of prostate cancer research is ever-evolving, with new breakthroughs offering hope for better diagnostics and treatments. Let's look at some of those. MRI-targeted biopsies. One significant advancement is the development of MRI-targeted biopsies, which combine MRI imaging with traditional ultrasound to more accurately pinpoint areas of cancer within the prostate. Genetic screening. For men at high genetic risk, such as those with BRCA gene mutations, research is exploring the use of regular MRI scans to detect prostate cancer early. New treatments. The introduction of novel drugs targeting androgen receptor signaling, immunotherapies, and even nanotechnology are revolutionizing the way we treat prostate cancer, offering more personalized and effective options. These advancements are not just scientific triumphs, they represent new horizons in the fight against prostate cancer, bringing us closer to a future where this disease can be managed more effectively or even cured. Thank you for joining us on this journey through the complexities of prostate cancer. Remember, early detection can make all the difference. If you found this video informative, please like, share, and subscribe for more health insights. Until next time, stay aware, stay healthy.